Good morning.
Morning, Christine.
How are you?
Turn my volume up here.
Yeah. Um, this is our other compadre. Oops, I'm gonna get my face fixed here.
I see Rebecca joined and I sent her an invite. Oh, but it's not saying that I did. Okay, let's try it again.
Oh my gosh, technology. It,
My favorite topic.
it's really a crime scene. Well, I'm glad I got in fast. That way you weren't doing what we normally do, which is the awkward business of staring at ourselves, trying to make small talk with people as they're trying to get on.
Exactly. It says Rebecca's unable to join. Rebecca, are you joining from your laptop? Because this happened to me before and I could only join from my phone. You have to put special things on your laptop to be able to join alive.
Yeah, don't leave us alone, sister. As I'm printing. Oh, I see her on phone. All right, send
So
a
that's,
send a request.
yeah, I've sent it multiple times.
Oh, I see. Oh,
Yes. Do you have me?
Woo!
Oh
Were you
my gosh.
were you trying from your laptop, Rebecca?
No, I was on my phone.
Oh,
So it was weird. Yeah, it was like maybe it was just buffering a little bit. Can you hear me okay though?
perfectly.
Okay, great.
Yeah.
yay! Where are you today?
My house.
Oh, you're outside. Or you're by a
Yes.
window.
So I'm right outside on this, I call it like the tiki bar part of my house because I'm from Southern California. So if I was going to move to PA, I made my husband build like an outdoor little tiki area for me.
Oh, that's
But
lovely.
and then the pool is back here. So we
Oh,
just opened it all up just actually this weekend because our oldest son graduates in 2 weeks. So we're trying to get all of that ready to go. So
It looks
yeah.
beautiful.
thank you. Thank
No,
you. It's beautiful here.
we're gonna show up in Rebecca's backyard, or on your
Please.
5 acres.
Yes. Come. Come. It's beautiful today.
It's
So
grey in Portland. I can't see any sky, just clouds. I feel just like I'm
well,
home in Ireland.
you can see mine right here, so you
Yeah.
can take them.
So Rebecca had quite an exciting week.
Yeah. Yeah, boy, it was just an amazing opportunity.
Do
Tell
tell.
Yeah.
everybody.
Yeah, so we here locally have a news station that does a 4 at 4, and they usually invite um, people to come on. And the one of the broadcasters had reached out to me a couple weeks ago. She saw something I had posted, and she said, "Hey, we love this idea of breaking the stigma of menopause. Would you like to come on and talk about it?" And I was like, "Okay, sure." I had never done that before at all. So, I put everything together that I could think about, and went on, and it was nerve wracking. I think my heart was beating absolutely outside of my chest. So, but it was what a great opportunity. It was just really wonderful. And they asked me to come back. And so, hoping we can educate some more women community, just everyone. It's not just educating women about it. That's for sure.
Oh, that's wonderful. I
Yeah.
can't believe they didn't give you a heads up about what questions they might ask. That's
Not
very
one.
nerve-wracking.
That that was more nerve wracking than anything. I was just like, okay, um, I'm gonna wing it.
Yeah.
So, but it was all the things. So,
Did
did we
Christine
lose?
disappear?
I think we lost
I
her.
think we lost her too. I'll just invite her again.
There she is.
Don't do that to us, Christine.
Yeah, don't do that again.
You know I'm.
Stop touching.
There's something going on with your sound, Christine. Are you on mute?
I don't think so. Can
No,
you not
you're
hear?
good.
I got you.
Okay, you got
Yeah.
me. All right, sorry. So, Aoife, we're on your live I don't, we probably have some people that will be joining or are joining from all of our different kind of group of followers. Why don't you kick off with intros?
Sure. So my name is Aoife O'Sullivan. I'm a family doctor here in Portland, Oregon, and I do menopause medicine mainly with the group called the Heather Hirsch Collaborative, and that's how I met Rebbecca and Christine, my two partners in crime. And we love our jobs. One of our favorite things, I think all three of us would say, is we get such joy from practicing this area of medicine and helping women like this who traditionally have been overlooked. And so I live here in Portland with my husband and two daughters who know more about menopause than most doctors I've met. And yeah, that's everything, I think. Who wants to go next?
Oh, Rebbecca.
All right. I am Rebbecca Hertel. I'm also a board certified osteopathic physician. I do family medicine here in Pennsylvania. I've been doing that for 15 years and I do see some midlife women also locally in our community. And I started working with the Heather Hirsch Collaborative, and that's why the majority of my midlife women health is through the collaborative, and met these two amazing women here along with the rest of our amazing group of women. We were the first ones to take Heather's courses, and so we got together and started this telemedicine, and it's wonderful. I absolutely love it. I see women in 8 different states, and it's been one of the most incredible things I've done in my career. I just can't say enough about it. So,
Awesome.
Christy?
Yeah. So this is where the 2 docs and a DMP.
Yeah.
That's where I tagged this. 2 docs
I love that.
I'm Christine Hart Kress. I am a board certified women's health nurse practitioner. I do have a doctorate in nursing practice. I'm also a menopause certified practitioner. Started out my career in the military. That's where I was a nurse practitioner for 27 years until I retired 4 years ago. Made a transition to civilian healthcare and as an administrator, and then decided last summer to come back to practice, and then took Heather's prescribing course, which is where I really learned everything I needed to learn. And then made the transition in March to Heather full time, just because this is such a great opportunity to practice autonomously for me as a nurse practitioner, but also to have such awesome collaboration amongst our providers. And Aoife and Rebbecca are, I'll 911 dial them if I have a question or if there's something that I don't know. And for the perfect practice because we all get along so well. We share back and forth. We all know something that the other one doesn't. And it just feels like we're just one big team. And sometimes it's hard to find as a nurse practitioner where you feel like you're an equal contributor, on a team. So I this practice a lot, and it's been.
Yeah, I forgot to mention that's how we all met through the course, actually. And what an incredible group of women. And then Nihar is our
Yes.
he's quite alone at the moment. I think he might need some more male colleagues.
Yeah.
But
It's incredible, right?
he is, yeah, and he juggles multiple balls. But one of the lovely things that came with the course was for us to join the Facebook group, the providers Facebook group, and running cases by each other. And Heather chimes in, and we have some specialists as well, some GYN docs and endocrinologists. Yeah, exactly, who chime in, and it's so helpful, and it's such an amazing source of information and friendship as well. We've all, like you said earlier, such a great group of people.
Yep.
Absolutely. Yeah. Yeah, absolutely. So, Rebbecca, the catalyst for today's topic was your interview and talking about stigma of menopause. And we were going back and forth this week about, okay, well, how many million women are in menopause and how many? Do you want to kick us off with some of that information?
Yeah, yeah, and there's so in the world, so we can even go worldwide. In the world, I think the last statistic I saw was 1.1 billion women by 2025. But in the US, 2 million women reach menopause every year, or 6,000 a day. And I've seen stats between 54 up to 70, 75 million in 2025 for women. So that's a lot of women. And that's not even discussing our perimenopausal women, who typically can have a really, really difficult time with that and just that transition. So this is just women that are, have hit menopause and beyond. So I still think that there's quite a big gap of women that are suffering in that perimenopause that, we're not even hitting. And so, women are 51% of the population. We're 50% business owners in the United States, and growing. And so this is a very important topic. We're very involved in not just our careers, but still, in families and being partners. And so I think it's a topic that we really have to not see as taboo any longer, because it really isn't. Puberty is something that all girls go through, and we're all very excited about that. And somehow menopause is taboo, and I don't know about you, but no one ever told me about it. So now all of my family, my 7-year-old included, all the way up to my adult children, all know about menopause.
I know. I have a 26. I didn't talk about that. I have a 26-year-old, and his wife is going to be in good shape by the time she is in her 40s and is dealing with perimenopause. And he actually was my first follower on Instagram.
Oh, that's awesome. That's awesome. Yes, I have a first year medical student, and is my oldest daughter, and she's just kind of, all about learning about this. And she, confirmed even now that, we really don't learn much about it still. So that needs to
No.
change. But
I mean, just from our training, the three of us can just quickly say, like, I was in medical school in Ireland, which is 6 years over there, and did a family medicine residency 3 years, and then came over to the University of Maryland and did another 3-year family medicine residency. And I don't think I have ever heard the word perimenopause until the last few years. And I certainly did not learn anything about menopause. Nothing. I think probably menopause equals hot
yes,
flashes and your period stopping. And that, as a physician with 12 years of medical training, and it's 30 years since I started med school, that was what I knew about menopause. And even as a woman.
yeah,
How about you
it
guys? What kind of training did you get?
yeah, I would say the same. So 4 years of medical school after undergrad, and 3 years family medicine residency training. And
Nothing.
I can't, right, stopping periods and hot flashes and night sweats. And, we were taught that if you're on it, or if a patient is on it, then it's for the lowest dose for the least amount of time.
Mm-hmm.
Mm-hmm.
Christine, how
Yeah.
about you?
Yeah, I remember looking at hot flashes, night sweats, vaginal dryness, maybe half hour lecture, and that's I was in the fact that one of my principals, I was with someone who now I say is older. For Polly's sake, she's probably younger. She was probably younger than I am now, but she looked older then. And she took care of all the midlife women, so I had quite a bit of experience. And when I transitioned, I my first active duty assignment, I was in a residency program, so I was 14, I called myself the 14th resident, 14th intern. And I remember lots of lectures, but none on menopause. The 4 years I was there. And then, yeah, so no. And you know what? I couldn't even figure out that I was perimenopausal. I had no
Right.
idea what was wrong with my job. I wasn't sleeping. My hip hurt. My ears were itchy. I had horrible hearing loss. And I'm like, well, I'm not having any hot flashes. I don't know what's wrong with me. And so, I gaslit myself. I'm like, well, I must be anxious and depressed. I put myself on medication and it wasn't any better. And then it dawned on me when I was watching YouTube and I saw a video by Mary Claire Haver. I'm like, well, golly, perimenopause and menopause, we've evolved. There's all kinds.
Yes. I think Aoife and I have talked about that before, that, the brain fog or the waking up with headaches, and, you just go straight to like, okay, do I need a CAT scan? Do I need an MRI? Is something wrong with me? I was like, word finding and couldn't complete my sentences, and would have to read, a patient's chart several times, and you're just like, wait, I was pretty, on top of things. And, not to mention the anxiety and depression and vasomotor symptoms as well.
Yeah. Ever since I moved here 20 years ago, I haven't been allowed to donate blood because of a disease called mad cow disease back in Europe. And
Really?
so I was thinking, oh, this is it. This is the mad cow disease. It's kicking in. That's what's wrong with me. That's why I'm looking at
Oh,
that yellow thing in the fruit bowl and I can't remember what it's called,
no,
Yeah.
you're like that. That
hmm
I think
The
it
yellow thing
remind
you peel and
yes.
eat. Yeah.
Yeah. And how many times have you yelled at, like, my children or my husband because I was, I know I put it there. And
hmm
they're like, no, you did not. You did not tell us, and you did
Yes.
not put it where you said you put it. Yeah.
Yes. I
So,
know.
Well, you know, you know, own difficulty finding someone to subscribe to me. My provider was like that was for my provider. I found that for third housing with menopause, um there's one menopause expert, one certified provider. And that was when I was like, okay, it cannot be this difficult. Like, it doesn't need to be this difficult. And that's why I decided that I was going to learn everything that I could and specialize, because I wasn't going to have people caught in a gap like me. And that's why I went ahead and I believe in certification, especially for nurse practitioners. I think that's how we get a with the physicians, is by showing those levels of expertise. And then, I took my certification exam, and, I was looking for 10. I was way, uh, but then realized it a little bit more um, of care, but not. And that are trying to act through their regular, and they are the runaround, and that's why I'm trying to be a certified provider. I don't know what you got from patients.
Christine, your sound is going in and out for me. Is it for you, Rebecca?
it is.
It's
It's going,
it's
yep, it was going
going
in
in
and
and
out.
out. I don't know why. I thought it was the closer you were to the phone, the better the sound was, but that doesn't seem to be the case.
All right,
Nope.
maybe I might come out and come back in. Let me do that. You guys go
Okay.
on. I'll come back in.
Okay. Okay.
Okay. What other
So I think
stats you got there for us, Rebecca?
So I think she was talking about the 32,000 women per one provider. So she was talking a lot about that,
Yeah.
right? And that it just, there's just not enough, and that the importance of being certified and going through a course to become certified. And how about now, Christine? Is that
Is
better
that better?
That's
so
good.
far? Yeah, that's real
Yeah.
good.
Sorry.
And so, I think some of those other statistics we were talking about too were, we live 30 to 40% of our lives in menopause. So there's a large, if we're lucky, portion of life left to live. We are not, old, frail. I don't know about you guys, but I'm probably in the best shape I've ever been in, and, well set in my career. And so there's, I'm ready to continue going and to travel and to, get the rest of these kiddos out of the house, and, so there's still a lot of life left here and a lot of education to be had and a lot of career, goals to meet. So it's not, I'm not being put to bed and I'm not being put out to pasture yet, you know? So, and I think that's kind of where that stigma lies, that we're, it's youth is very glorified in our culture. And, but there's so much more to that. There's the, as you're aging, the experiences and the education and the learning. And so, we still have a lot of vitality as we're aging.
Yeah. Yeah. Something you said there triggered a memory for me. When I'm talking to other clinicians and I'm talking to somebody who hasn't had any training in menopause care, and I say to them, the average age of menopause hasn't changed in hundreds of years. It's been like 50, 51, 52 all this time. However, 100 years ago at 52, we'd get a dental abscess and die, or the
Right.
flu, or, a cellulitis, and we'd be dead. So a year of hot flashes and you're gone. But now, like you said, we live 30 to, what is it, a third to a half of our lives
Yeah.
after menopause with no hormones at all. That I personally feel is not natural. I wouldn't do that to my pet,
Right.
no less a human being.
No, I agree. I agree. Yeah, same thing with, thyroid disorder. And I couldn't imagine, I've been on thyroid medicine for 20 years. I couldn't imagine not replacing
Right.
that for myself. And I would not be able to function because it was in medical school with a TSH of like 135 and I couldn't remember and I couldn't go up and down the stairs and I couldn't until I figured that out, replace that good old little thyroid med and I was, back to doing what I was supposed to do. So for me, and yes, it is a personal option, but it has to be an option. You have to be educated about the options that you can choose to have, and for all women, it isn't always difficult or isn't as difficult. Although I think when you start talking about all of the symptoms that can surround it, I think you'll have a lot more symptomatic. But I think we owe it to women to give them the whole package. This is what's offered, and these medications or choices that you make have an impact or could potentially have an impact on your life moving forward. Osteoporosis prevention, cardiovascular disease prevention, your brain health, your musculoskeletal system.
Mm-hmm.
So
Mm.
I posted recently.
I lost you again, Christine. Dang.
Problem?
I only feel like when you start to talk faster
Oh,
or have multiple sentences.
that's when you
If you can just be monosyllabic, Christine, we should be
maybe
good.
just
We should be good.
maybe just one word at a
add.
time.
I will speak. I will not speak New York speak. Now, now remember what the hell I was going to say. Oh, that women decide, make choices. One of the analogies that I've been talking about is, if your thyroid went out, you were producing no thyroid hormone, you have the same symptoms as when your ovaries run out or go into retirement, and you don't think twice about taking thyroid replacement medication. We should be thinking about it in the same way. But, there was a study by the Journal of Women's Health, and they said that 37% of menopausal women felt shame related to their symptoms, and 83%
Isn't that awful
Yeah.
to feel
I mean,
shame that you're going through that? I think that's just unacceptable.
absolutely.
well, I think when you grow up in an environment where nobody talks about a particular topic, you are led to believe that that's embarrassing, shameful, and the whole stigma comes from it. And I'm just thinking of, say, our parents' generation. Women did not meet up and discuss menopausal symptoms.
No.
You
You
know,
know, go on,
no,
Christine.
no, I was just going to ask, for what you're, I'm the one of my friend group on hormone therapy, and they're older than me, and never once did they talk about their menopause symptoms. And even for me now, I feel a little weird talking about it with, I don't know, I think because my mom said menopause lasted 20 minutes for me. Move on. So,
Yeah.
Yeah.
Just suck it up, right?
Because
Suck it
no
up.
one
It's
told
part of
her
life.
the palpitations and the low mood and the anxiety and the lack of sleep and the joint aches and pains were related. Yeah, it was just periods
Right.
and hot flashes.
Right. And I think even for women, some, yes, the vasomotor symptoms can be disruptive, and they can be a pain, but some of the other symptoms are far more devastating for them. Just the mood disorders that can, worsen or come about, the anxiety, the depression, and, just the dark thoughts. And those, I think there's a big stigma around, women don't want to talk about that they're having terrible thoughts or dark thoughts or anxious, or they're irritable with their children, and or they don't even like to be hugged by them. Those are things that we're not good moms or spouses if we talk about these, or partners if we talk about these things. And that can be pretty devastating for women, and they live in silence, not knowing that this can be a part of that transition, and there's help for that.
Yeah, 100%.
mhm.
you know so I think, the big thing is just continuing to empower women to talk about this, um, that to openly talk about their discussions. Definitely, my most of my girlfriend group, um, they're a little bit older than I am, anywhere between, 5 to 7, not quite 10 years older, and most of them are on HRT, and every once a week we get together. We try to. Sometimes it's a little less, but that's what we're talking about. And I'm like, we just sit and chit chat about it and talk about it. And our younger girlfriends who are starting to go through it, we talk to them about it. And, my goal is that not only my patients, but my daughters will 100% know. I think one of my good friends who's a GYN is like, I don't tend to go through menopause. I'm just going to throw a patch on and have my IUD and sail the rest of my life that way. So,
Yeah, good advice.
Absolutely. Rebbecca, you had mentioned about never having heard about, and about, that you had made the comment, we all agreed, that we really hadn't heard much about it. It sure as heck wasn't taught anywhere. And I did, I saw a research article, or maybe it was a commentary, that they were talking about, and the timing is probably right, because fibromyalgia became a lot of buzzword after the Women's Health Initiative study. And I remember being a young provider going, okay, none of these women's seem related in any way. And the things that went through my head, I am embarrassed to say, the things that I might have slipped my mouth,
We lost
woman,
you again, Christine.
good Lolly, I don't know. Can you hear
in
Yeah,
and out.
me?
And
Ugh.
then it'll be good for a little
yeah,
while.
Anyway,
We got,
can you hear me now?
yeah.
mm-hmm.
I I am, it's, I think about, how many women we could have helped more than giving them gabapentin.
Yeah, I agree. Right.
Yeah.
Gabapentin,
And do you
Cymbalta, all those.
remember when we were told then, after years of hearing about fibromyalgia, that it had been decided it was a sleep disorder,
Mm-hmm.
all stemmed from sleep problems. So, it just all makes sense. I wonder how many women have been misdiagnosed with something
But,
like that.
oh yeah, and now it's, definitely in my family medicine practice, when I start seeing, that perimenopausal age and the, possible fibromyalgia, and then my little brain goes off and I'm like, so we have a very long discussion about that, because I wish we could do a study on that, quite honestly, to see how many of these women that, if they were chose to do
Yeah.
HRT and stabilized and felt
Hmm.
better, because
That would be a great
I,
study.
I think that
Mhm.
we would find that it, it just correlates, and it doesn't correlate, I think, for without reason,
Mhm.
you,
What it
you know.
is that, in the health, you know,
No,
We
you're
lost you
gone,
again.
Christine.
Now you're gone.
really.
No, now you're back.
Just that 15-minute
Oh.
appointments but that, we're not talking to patients about what to expect. So that then they're aware when things start to change. Like there's no pre-menopause.
That's right. And I think part of, this erasing the stigma is that when women in, I think over 30 for sure, when they're either in with their GYN and I know it's really hard, or their family medicine, or both, that they need to start saying to them, okay, this is what can happen. It may not happen in this 10 years, but this is what could happen. This is what, you need to start looking out for. These are the changes that could start occurring. And just like we did with puberty, right? I mean, how many of our I counsel young girls every day on their cycles and if they're going to start, and this is, what may happen, and their length, and are they heavy. And so it's second nature. And why we don't do that for women as they're approaching, perimenopause or menopause age just doesn't make any sense to me.
And it doesn't have to take time out of the visit either. Like I use a questionnaire, a menopause questionnaire. The one I use is from the Balance Menopause website that Dr. Louise Newson in England created. Such a fantastic resource for clinicians and patients.
Yes.
And it has a whole host of symptoms on it. It's 1 page long. And if my patient is a female, 35 or older, I just ask my MA, if you're rooming a woman, she's 35 or older, just
Hmm.
give her this to fill out while she's waiting for me to come in. And I can take one glance at that and it'll really help me. If everything is in the negative column, then we're good. You know,
Right.
I'm going to
Right.
invite Christine again.
Back in.
Um, and I don't have to worry about it. But even when someone comes to see you once a year, you can do it. It's so easy.
Right. And sometimes we only get that once a year because,
Yeah.
when they're healthy and they just don't really need to see us more than for their annual physical,
Yeah.
which is typically a longer visit, you know,
Yeah.
um, you're right. It's easy just to say, or you have some handouts. I have some handouts that I have printed, and, we can have those all set and ready, and give them, the resources or online resources, and books. And I think there's a lot in the toolbox, that we can give them, or to help them build that toolbox
Yeah.
is important.
And a little off topic, but just for any clinicians listening, a great way to recognize perimenopause is when you've been seeing a woman every year for her pap smear or her yearly exam, and now you're seeing her every few months or
Yep.
every few weeks, and she's got tennis elbow, and she's got palpitations, and she's got headaches, and she's got low mood. She ask her, has she bought a tweezers for the car and her purse? And
That's right.
ask her, does she want to murder her her beloved spouse for chewing too loud? And I feel like they're good
Yes,
screening questions for perimenopause.
there are. And sometimes no amount of estrogen can help the chewing issue.
I know.
They stop.
But yeah, but absolutely, it's true. All of a sudden things aren't making sense. They're anxious about things, and, their life hasn't really changed, or it's just as busy as it always has been, and that I get that a lot, the anxiety. And then you start diving into those questions. And so, the hope is that as all of us talk about it more, and we hope that our patients start talking to their girlfriends about it more, and that our girlfriends talk to their girlfriends, that that is truly the way that we erase this stigma and completely get rid of it. Because I don't see the population of women going down anytime soon. So I think we're a pretty strong force, and we're very active in communities and in the workforce. And to feel there was no way at least for me, that I could have done my job on the level that I was used to doing my job before. It was like the neurons were just not connecting like they were. And so, for a woman to feel that they have to leave their job and their career because they're not functioning on that level just seems just unfair and absurd, really.
Mm.
And I saw the article that talked about some of the body. I saw it as listed as making for in the workplace. It only creates more stigma to things like a cooling room or special time opportunity or break work, but get access to care and affordability for much.
Yes.
It should be accessible for all, both things. And it's been horrifying me, some of the things that women are coming. I had one the other day who's providing older. What do you need to have sex for? You're 55. Who cares if it hurts? A little lube. What?
That's devastating.
It is. Or telling or threatening patients, well, you can stay on it for another year, but then you're going to need to come off at 5.
Can you
Right?
imagine saying to a man at 55, what do you want to still have sex for? Don't worry about it. Just don't have sex.
Right. Yeah.
Imagine, like, I always reframe things like that. When I hear something's been said to a woman, I immediately reframe it into, would that have been said to a man, or would I say that to a man? And that really helps me realize how ridiculous and so insulting and
It's
demeaning some of these things are. Yeah.
Yes. Yes, very. And I think we hear those stories at the collaborative every day. That's usually why they come to see us, is because they are being told those types of things, where they're not being given options, or they're not, being given options that are according to the current guidelines. And that's typically, why we're getting them, whether, it's you shouldn't have to have sex, or painful sex is fine, or, just turn on a fan toward you and keep everything cool. And those hot flashes, it's just a part of life, and suck it up, that too shall pass
Mm.
type of thing.
Mm-hmm.
Or
Is
drink a big glass of ice water in the middle of the night, wake up hot and sweaty. I heard that one. I heard a provider say that. I was like,
that's good. Look, that'll make you get up and pee, which you probably are already doing in the middle of the night multiple times.
I know. It almost to the point is that if your education hasn't kept up with the times, you have an ethical responsibility to catch up or get out of my.
Yeah. Yeah, and I was giving a lunch and learn locally, and I just kind of also said, it's okay if you don't prescribe HRT. It's okay. And you should be educated on menopause. But the big thing is, find someone who you can send your patient to. Then that's at least your responsibility. Like, okay, you don't know how to do it, you don't understand it. At least you know that it's an issue, and that women deserve options, and they deserve to be treated.
Right.
Find someone that you can send them to, because they don't have to leave their PC. If they love their PCP or their GYN, that's fine. That's what we're here for. We can take them and fix them up, and they can still,
Yeah.
go to their primary care, go to the GYN they're seeing, as long as they're not gaslighting them on on their options and how to
Yeah.
treat their menopause or perimenopausal symptoms. So I think that's I left that lecture kind of with that, just that, you at least have the responsibility to find them someone to
That's
help them.
wonderful, Rebecca. Yeah. I mean, I don't know much about sarcoma, but I don't say to my patients, oh, we see a sarcoma on your scan. This is lethal. It's going to kill you.
Right.
See ya. I mean, I say, oh, I
Figure it
know
out. Go
someone.
research.
I
Yeah.
know exactly where to send you. Let's work on this together. I'm not a sarcoma specialist, but I know somebody who is, and they will be able to guide us and help us, and we'll get you through this. You know, that's what I say to them. But this is the
Yes,
only area in medicine I feel where clinicians feel they have the right to scare the bejesus out of women with nothing to back it up. Like, you know, a TV clip from 20 years ago that they saw. That's the amount of their
yeah,
knowledge that they have. And yet they feel they have the right to say to women all these kind of statements, like that are based on thin air.
that's right. That's right. You know, not just that, and I think there needs to be, you know, this education for our pharmacists as well, because we may be able to, how many of us are just like, oh my gosh, no, this, you can take this. It's not, it's okay. It's not going to, you know, kill you. It's not going to, you know, and
Mm-hmm.
we get those kickbacks all the time.
Mm-hmm.
So there's that realm as well. They're going to pick up their medicine that they've trusted that we're giving them. And then, you know, their pharmacist is not educated. And they're getting kicked back there.
Mm. And again, if we were starting a blood pressure medicine or a diabetes medicine or anything, we would say to the patient, this is what you need, this is how it works, these are the risks and the benefits. It was like a 5 minute conversation.
Yes,
But we've already, when it comes to hormone therapy, we've already spent like an hour
yes.
going through trying to eradicate all the misinformation they're carrying in their head and the scare stories that they've heard from other clinicians, or articles and papers. And so we've put in so much time, and then they go to their pharmacist. And I know we're all on the same page. We feel for our pharmacists. They are
Yes.
being
Yes.
crushed
Yes.
by these big corporations. They are, you know, I'd say right now is a really miserable time to be a pharmacist. So we're not dissing
No,
pharmacists,
no,
but
not at all.
there's no education there for a
Hmm.
lot of them, I think, just like ourselves.
Right.
So everything, we need to go back to scratch. I mean, I don't know how long it takes to change medical school curricula or pharmacy school curricula, nurse practitioner school
Hmm.
curricula. I don't know, but it needs to be done. And we need to, you know, we all have to reboard every few years. We all have to do exams or questions or read papers and answer questions on them. That has to be an integral part of
Hmm.
everybody. There needs to be retraining, you know,
That's
even
right.
if it takes 10 years to get it into schools and
That's right.
residencies, we can still do things in the meantime.
Yeah.
Uh, I worked for a provider who's been uh, OB/GYN for like 40 years. That this year was the first year that they had an article on menopause.
And it was an amazing article.
First time.
Yeah.
Isn't it just is unreal to me? It's almost, yeah, I just can't comprehend it. Yeah.
And even if it was just male clinicians who knew nothing about menopause, that would be, you
Yeah.
know, very
Yeah.
awful. But how have they got us to the point where even female clinicians who will all go through this
It,
know nothing?
it's inevitable, right? We were talking about that. You can't outrun menopause.
No,
It's coming. It happens to every woman.
Uh,
it is.
um, I think when I was getting clipped out before, one of the things that I, was saying was about, trying to provide this care in the normal insurance-based model. For me as a clinician, it was just not satisfactory. And when I was in private practice, I would book my last patient before lunch for a menopause consult, and then I would spend their appointment plus my lunch because I felt like it was too important. There's too much education that needed to be done. And so, that's why I decided to come over to our telemed practice, because we get an hour, which I always spend more than an hour. Most of the time it's like an hour and a half. Um, I know our boss is watching us today. Shh, don't tell her that I spend more. Um,
Shh.
but that's what it
Yeah.
It does. And I can tell you that the women that do come to me that are educated, it then that's when that hour you can really use that well, and you have enough time, you know, when they come at least with some education,
Yes.
and some idea. But when you start from scratch and there's so much fear, you know, you first have to just decrease that, and before you can even get into the rest of the conversation about risks and benefits, you're just, you know, really, you know, validating first their feelings.
Yeah.
You know, yes, absolutely, what you were feeling is 100% correct and you are validated.
Yeah, I love that course that Dr. Hirsch made. And she sends our patients every time they make an appointment. And it's 8 hours that you can watch at your own pace. You
Mm-hmm.
know, in the car, you can just have it on the stereo as you're driving, listening to it. And takes you right from square one to where you are now, explains everything. And I find some of the patients I see, they haven't watched those videos beforehand, and the appointments feel different than they do when
Yes.
my patient comes in having watched that those educational videos, because I feel like I can speak in medical speak and we're both on the same page. It just, everything goes so much smoother. It was a great idea to do that, I think.
It really is,
Yeah.
because some of those questions that they had are
Yeah.
already answered, or they'll come with some thoughts on what their plan is that they want, to start with.
Yeah.
So yeah, it is really nice. Or if they haven't had a chance, then, they'll chat back and say, oh, okay, this all is making sense now. And
Yeah. It,
so it's a great, it's a really just a nice thing to have offered.
mm,
Yeah.
we're missing you again,
We lost you.
Christine.
We lost you.
Really?
Yep.
Now?
No, you're good
Nope, you're
now.
back now.
Just put the phone right up to your nose and
Wait,
then
like,
speak really loudly.
The, um, that,
No, we missed you.
what about now? Now?
We're catching little bits of you.
I don't know.
see, now
There,
it's
you're
working.
good now. Don't move. Don't move.
Just that I had seen two women this week who said, I felt like I now have a PhD in menopause because if I didn't learn, I'd be by.
That's great.
That's wonderful. Um, will we go back to the stigma in the workplace a little bit, the stigma of menopause, and talk about that for a few minutes? Yeah,
Yeah, we can
in the
definitely.
workplace.
Yeah, so I think, Christine, you were talking about, I don't think any women need, a special chair or a special timeout place, right? I mean, but the whole fact that, they're, I think we talked about the time off of work, taking more time off of work, retiring earlier, increase in healthcare costs, doctor visits, and antidepressant medicines, and I think that, at least in my opinion, once that is sorted out a little bit easier and women are understanding that they have options, then the workplace environment becomes a lot easier for them. They don't have to, they can feel like they can be as sharp and on top of things as they have been before. I think one of my patients told me, she's like, I can't, get emotional when I'm in my board meeting, and I need to be able to, continue to be this strong woman in this, boardroom of men or whatnot, and to have a hot flash in front of them is just, devastating for for anyone, but for her in particular.
Yeah, and the word finding is an awful difficulty for women as well. You know, just having to get up there and make presentations on front of people, even having to have conversations with people on the phone, and you stop in the middle of a sentence and can't remember where you were, what you were going to say. That is devastating for women. These women who've reached, like you said earlier, this position in life where they are CEOs, they're running
Yeah.
their own companies, they are that, I think it's called the sandwich generation, you know, where they're still raising kids, but their
Mm-hmm.
parents also might need their help as well,
That's,
and they're
that's right.
working, and you know, usually are able to cope with all that, and juggle all those balls. And now, you know, I think a lot of it is starts with the sleep
Yes.
disturbance. You know, so you're dealing with someone who can't get their sleep anymore, and if you did that to anybody, it's going to have effects on you, you know. um, I know you guys know, but just for anyone listening, Dr. Lisa Mosconi, who's a neuroscientist over on the East Coast and does MRIs and PET scans on women's brains before and after menopause. And the results are,
It's outstanding.
oh
It's
my,
astounding.
oh my
I
God.
couldn't
I mean,
believe it.
I'll never forget the first time I saw the photos when she puts them side by side.
Yes.
And so before menopause, you have this brain that's all lit up with these beautiful colors, and they signify glucose metabolism and brain activity, which is very much dependent on estrogen and progesterone and testosterone levels in your brain. And then the same scan on the same woman a few years later after menopause, and it looks like a completely different brain. Those colors are dull. They don't cover as much of the surface of the brain as they did
Right.
previously. And she said that that's actually like a standard scan. Some women's are better than that, and some are worse. And she says even though our brains do that, that when you do, neurocognitive testing and on these women, they'll still get the same results as their male counterparts. It might take them a little longer to get there, but so we still manage to get the job done. It's just so much harder for us.
Yes. And I screenshot that and sent that to my husband, and I thought, isn't this scary?
Yeah,
Because when you saw that side by, it was profound.
yeah.
Yeah. So you're
Yeah,
right.
you can Google that if you're
Mm-hmm.
watching. It's Dr. Lisa Mosconi. And I'm
Was that
sure if you look up
a TED
images, it'll
Talk
pop
that
up.
she did, maybe? Was that a TED Talk
Yeah,
that she did on
maybe.
YouTube? I saw
Yeah,
it off of your link. It's also, I think, on your link tree, um,
yeah,
if I remember
that's right.
right. Yeah.
Yeah,
And I think that women are used to feeling a common, like their environment, there should be a demand to HR, need the education for us, the women working. Our bosses need education, probably save marriages. And then, being able to have access to hormone therapy, it should be easy peasy. We shouldn't have 5,000 prior authorizations for
Yeah.
estradiol and progesterone, for Pete's sakes. And stop telling me the only thing you'll pay for is Premarin, because that's not where I'm going.
yeah. Everything should be covered 100%. I really feel with 50% of our population all going to go through this in their lifespan. And for women who can take hormones, that will decrease your risk of cardiovascular disease by 30 to 50%, decrease your risk of diabetes by 30%, decrease your risk of dementia by somewhere between 20 and 60%, Alzheimer's
Mm-hmm.
dementia. I mean, it behoves the insurance company to pay for these things. And I want my patient, if she wants to have a fem ring that you can insert yourself, push up around your cervix, leave it there for 3 months, and then take it out and replace it again. If she wants to have that,
Easy.
I don't want her to have to pay $500 out of pocket for that. That should be covered if that's the choice that she wants instead of a patch or the gel or the tablet. That should be fine,
Yeah.
you know?
Yeah. Even
A
the gel with
$3 ring.
right. Even the gel with my own insurance company it's absurd,
Mm-hmm.
the cost.
Mm-hmm.
I am being,
We lost you again, Christine.
hear me now?
Yeah.
Um, I'm used to getting whatever I want for meds for
Oh,
free.
yeah.
And I tried to get Opera, said, no. I'm like, oh, why? So I wound up paying for it out of pocket.
Mm-hmm.
Um, you know, I mean, it's part of the trio. It's helps with brain fog. It helps with libido. It helps with bones, decreasing bone loss, heart health, brain health. I should for it. It's $100 for a year prescription. My 20 cents. Give me $100.
Mm-hmm.
Yeah.
Yeah, and it is FDA approved for hypoactive sexual desire disorder. And 90% of the time, when something is FDA approved for a condition, that means it's covered by your insurance. And yet they will put every obstacle in your way not to pay for that. Yeah.
Mm-hmm. And I think they often forget that we produce a lot of testosterone, a
Mhm.
lot,
Yeah.
not as much as a man, but it's a lot, and that's
Yeah.
kind of part of the estrogen pathway,
Yeah.
and So I remember, even my husband listening to a podcast that was probably playing, and he said, "Wait a second, you're telling me that the only way they're going to pay for testosterone is so that you will want to have sex?" He's like, I mean, I'm all for that, but that just doesn't make any
How
sense to
insulting.
me.
Yeah.
Yeah, that's exactly. He
Yeah.
was just like, what? So, if even our guys are like, that just doesn't make
Yeah.
sense. That's not okay.
So insulting.
Mhm.
And Dr. Kelly Casperson said, I think it was on one of her podcasts, how insulting it was, and also how misogynistic and paternalistic,
Yes.
because in general, most women in this country are heterosexual. And so really what you're saying is you're keeping the men happy,
Yeah.
is what you're saying,
Right.
So yeah, I just think women have had enough of this bullshit, honestly.
Yep.
Um, and not, I was never a massive fan of social media. I find I get sucked into it and it can be, dangerous enough. But for this topic, for women's health, I mean, social media has just been
Yes.
such a miraculous kind of part of it, hasn't it?
Yes. It's been huge. Sorry, are you hearing my kid, I think, mow the lawn?
Oh, yeah.
Can you hear me? I didn't know how loud that was. Yeah. Yep. No, I agree. I think this has been a really great way to help, erase this stigma is getting the word out there and educating this way. So again, that trickle down effect, hopefully to everybody else,
Mm-hmm.
And we're not stopping.
Yeah.
We're trudging through, I think, we're a force to be reckoned with. That's for sure.
Mm-hmm.
So we'll keep doing the job, and we're going to keep educating and keep, keeping our women healthy and taken care of and being advocates for them.
Yeah. Any last words before we kind of tidy up and finish the live? Any advice?
I don't think so. I think I think this has all been great. An hour went by already.
I'll say, because the women that we see day after day have come to us having seen multiple different clinicians. And even some of them are on the North American Menopause Society, currently called the Menopause Society, list of providers who have sat the exam and know everything they're supposed to know, pass the exam, and yet have been to see one of them and were not helped.
That's right.
So, what my last piece of advice would be, if you are looking for someone to help you, you can go to the Menopause Society list of providers and find a few around you and make some phone calls. Do not make an appointment without making a phone call first and finding out, do they treat women who are going through perimenopause? Because so often I will hear, they wouldn't give me anything because I'm still having periods.
Yeah.
And that is not based on any factual or evidence-based medicine. That's
That's right.
ridiculous. And we all know that perimenopause is the most symptomatic time of this whole menopause transition. So make a few phone calls. And then the other thing is, there are a whole bunch of us who work online, telemedicine, like our group, the Heather Hirsch Collaborative. So, do some research before just kind of hopefully making an appointment and hoping that person will help you, because sometimes the wait times are 6, 8, 9 months, and that's a long
That's right.
time to wait to find out that that person is not going to treat you. That's
No, that's
my
a
two
great point.
cents.
Yeah, my best advice is not.
Oh, we lost you again,
Say it
Christine.
again, Christine.
Say it again.
My best advice, you hear me now, is don't tag on this here exam. It needs to be its own with your partner. There's just too much to do with exam.
You're gone again. Christine is saying, don't try and tag this on to another appointment. Like you're going in to see your doctor for your yearly physical or your pap smear or whatever. Do not try and tag it onto that. It's too detailed and too nuanced. Is that right, Christine? Yeah.
Yeah. Am I back in?
Yeah.
Yes.
And then, oh, just with the collaborative You do get to use your radio.
We lost you again.
The collaborative.
Yes. So Christine was saying we can use your insurance for labs and prescriptions, radiology. Yes.
Yeah, and if you
Exactly.
have a HSA.
HSA card for the visits.
Yeah.
And then the Facebook. Someone
Oh,
talked.
yes.
Yes.
Yeah. Do you want to talk about that, Christine or Rebecca, the Facebook community for the
No,
patients?
yes. Yes, you get, yep. So when you become a patient, you also get this great Facebook community where patients can talk to each other and interact with each other. And I believe that there's monthly education, not just education, but they've had women that come and talk about journaling. We had genital urinary syndrome and menopause. I think there was another, this past one was about like, I think like meditation and spirituality and things like that. So just lots of really neat little things there as well. Plus just this community that women can chit chat and talk about their own experiences and, hey, have you seen this? Have you experienced that? And so that's really nice too, to have, and a lot of women will, answer each other's questions and, especially if they've had the course, then they're also able to do that too. So,
yeah.
all right.
Really
Awesome.
supportive group.
Very supportive. Just like everyone here as well, everyone in the collaborative. It's a really amazing group of clinicians, and so it's a lot of fun.
Really
So
fun. Yeah.
all right, ladies, it's a beautiful
Christine,
day.
tell me how to stop this. Do I just press the little airplane?
The X.
The
The X at the
X?
top.
And
Oh, the X?
save
So
it.
I just X out?
And then it'll talk to you about saving it.
Okay.
All right. Thank you, everyone. And
Bye,
you can
everyone.
hit us up on our Instagram if you have any questions or whatnot. So we're all there. So y'all have a great Sunday.
Happy Sunday.
Bye.
Bye bye.